known that men aren't maybe the best about going to the doctor.
That's true. It's often an issue for men, but there is an important discussion that we should be having. 1 in 9 men will be diagnosed with prostate cancer sometime in their life. More than 30,000 men in Minnesota will be diagnosed with prostate cancer in 2019. Dr. Dan Wattson, a radiation oncologist from Minneapolis Radiation Oncology, is with us here on Mid-Morning. Dr. Wattson, thanks for coming in.
Good morning. Thanks for having me.
These numbers are troubling. 1 in 9. It is tremendously common.
It is the most common cancer that men get, besides just superficial skin cancers that are easy to take care of, and so it can be a major cause of health problems in men.
Sure.
And is prostate cancer, is it treatable in most cases?
It is very treatable. As you heard,
Yes.
it's the second leading cause of cancer death among men. But that said, it's just a testament to how common it is. It's a very treatable cancer, and especially if it's caught early, it can be fully cured.
What do men need to know about recognizing the symptoms, about going to the doctor and get checkups?
Really, the most important thing is that if a man is having symptoms from prostate cancer, it's often at advanced stages at that point, so it may not be curable. But there are tests that one can do to try to determine if there is an early prostate cancer that is treatable and potentially curable.
Is this something that men, if they go to the doctor's office for an annual checkup, they would get those kinds of tests, or something that you have to have some symptoms where that's would spur it on?
Well, so generally, some physicians will provide testing, but often a man has to ask his doctor for testing.
I mean, are you really suggesting that men, that it more widely be tested, that more men ask for testing? I know there's a lot of debate in the cancer world as to whether having early testing, widespread early testing is always the best way to go.
That's correct. There is debate, but especially men who are healthy, men who may be at higher risk for prostate cancer, such as having a family history of prostate cancer. African American men are also known to have higher risk of prostate cancer or more aggressive prostate cancer. So those are the men that really should be tested for prostate cancer.
I know this isn't a cancer that people really like to share about or open up about, but you talk about some of these symptoms, even if they're later on. What are we talking about there?
So local symptoms can include, so the prostate is a gland that's right below the bladder, so it can cause urinary symptoms, can block the flow of urine, but after it spreads, it often goes to the bones, and it can cause pain in bones.
I see.
Yeah, and sometimes it's those pains that people don't know what's going on, and you just think, as a man, you think like, work itself out.
Of course. And that's not to say there's a lot of men who have aches and pains.
Of course,
that have nothing to do with
absolutely.
prostate cancer, but it is one of the common signs.
And is it older, younger men, or any age, really?
So it is a cancer of older men.
Okay.
The average age of diagnosis is 66 years old, and so it's generally men, but 90% are older than 55 who are diagnosed with this cancer.
All right, it's important to talk about, and you can team up with MRO on Saturday morning at Lake Nokomis for the Zero Prostate Run Walk. For information on that fundraiser and for more information on treating the cancer, go to WCCO.com/links.
All right, Dr. Wattson, thank you.
Thank you for having me.
So it's not your typical school or church fundraiser.